Good morning, everybody. Today marks 218 days. We've completed 31 full weeks since Albany County's first COVID-19 was identified on March 12th. It's hard to believe it's been almost 7 months. I said it from the beginning, it's going to be a marathon, not a sprint. We're going to be in this for a while, and I can tell you Dr. Will and I both hope we kept waiting for that vaccine to come out so we can continue to move forward with life. But unfortunately, our numbers continue to go up, and I know a lot of people are getting nervous. Is it, we hitting another second wave? You see what's going on over in Europe right now and other countries as the second wave is hitting and the numbers going up. Some people can say we're doing more aggressive testing. There's a variety of reasons. I'm not a scientist, so I'm not going to sit here and pretend that I know the reasons why. But as of today, there's 325 new positive cases of coronavirus, which we've had cases in Albany. 914 people under mandatory quarantine, and it's an uptick today of 27 positive cases overnight. We had 22 new positives yesterday, and as we sit there and do our little equation and the math behind it all, since October 1st, we had 291 new positive cases. Compare that to April 1st to the 15th, when we hit the height of this, we had 297 new cases. So as we look at where we were back in April versus today, our numbers are getting back and spiking up. But again, we'll be announcing some new testing sites. More people are getting tested. We don't know what it is, and we're trying to figure it out. And we're not trying to make people panic. We're telling people to continue to do the right thing. Wear your mask. Cough into your arm, clean your hands, and stay 6 feet apart, and continue to do the right thing. We're hoping with people wearing masks that it's going to keep down the flu and also stop people from getting COVID-19. I can't explain it. I've talked to a lot of people. We get a lot of questions on Facebook. We've been in conversations on our control room with CDC, with the White House, every expert there is, and all I can tell you is as we get the guidance, we put it out there. But we need to continue to be in this together. It hasn't gone away. It's not going away in 21 days to the election. It's still going to be here, and it's still there. And I'll give you case in point. And I talked about last weekend my daughter's wedding, and some of my family had a birthday party for their niece, and it started with one person. Then it started with 2. Then it started with 5 people at the party. This was 2 weeks ago. Now my sister, husband, and son all have it. All from that same party from over 2 weeks ago. So you're seeing even past that 14-day window, people are getting it because they self-quarantined for 14 days, and then yet when they should have been able to come back out, they tested positive. So you're seeing this reality of, I know we feel because we're family or we're friends and we can let our guard down, and Liza said this 1,000 times. You can't. You have to stay vigilant. You have to stay on top of this, and you have to know it's there. And again, I don't want to rub it into my family, but I'm like, I've told you. I've told you how many times. Just because you're family doesn't mean you're not going to get it. Just because you're friends doesn't mean you're not going to get it. So that's going to get me in trouble with my sister and brother-in-law. Love you guys. But point to be made. It can happen. Even within families trying to do the right thing to go forward. So, and out of the new positives today, we also know 17 had close contact to positive cases, and then 1 reported out-of-state travel, 1 healthcare worker, and 8 don't have a clear source of infection. So as the EPI continues to do their job in tracing this, we can pinpoint it down, but we have to be careful. We have to be careful. And then also, we had a total of 14,179 people have completed quarantine, 3,144 tested positive for the virus. That's 18 recoveries since yesterday, which is all good news, and things are going the right way. So they're still And this is the thing that we continue to watch, right? Because as this virus continues to morph and change, it is affecting us differently. But we look at the hospitalization rate, and it's starting to get a little scary because we're starting to see that number go back up. There's still 7 people currently in the hospital, a hospitalization rate of 0.21% that have tested positive, and the rate was 0.21 yesterday. 1 patient currently in the ICU, and that number yesterday was 3. So it's like we go up, we go down, we go up, we go down, to pay attention. Over the last 5 days, there's been an average of 18.6 new positive cases each day. Yesterday, it was 16. Our numbers continue to go up with an increase in hospitalization as well. When we say we need people to do the right thing, we mean it. We need you to do the right thing out there and continue to do the right thing to get through this. We can't get relaxed, as my daughter Taryn likes to say. We need to stay vigilant to get through this. Again, I'll say it 1,000 times, wear the mask, off in your arm, and do the socially distance, and hopefully we'll get through this. So even if you don't have signs or symptoms and you feel like getting tested, we want you to get tested. And there are plenty of places to go now. So I want to add some of the new testing places that are going on for testing sites. Even if you don't have insurance, we pay for it. Albany, you don't have to get charged. Our site, you don't get charged. And if you have if you want to get your children tested, you can go to our website as always to find out where you can bring your children to get tested. But Albany, so Albany has a drive-through, which they never have charged since the beginning, so I commend Governor Cuomo for his leadership on that. You have the Whitney Young site, so also please, if you don't have insurance, we will pay Whitney Young for your test. And as always, you know that University of Albany appointments, you can call 1-888-364-3065, and the Whitney Young mobile testing site, as always, is available at 518-465-4771. But some of the other things we're working with the University of Albany and the governor's office is we're doing a partnership, and the state is we're setting up testing at the University of Albany and the College of St. Rose for students on their campuses in the Midtown Albany this afternoon and Saturday. This is going to be part of the new testing requirements as we go forward, so we'll be there today, this afternoon, and Saturday for students that live around the College St. Rose area and the Midtown. I would give out the number, but the students know who to call, and it's already full, so which is great. All the students are already filled this afternoon, and every appointment on Saturday is taken. This is a new approach that we're going to be taking with the college kids in the Midtown areas that live in our city, that are embedded in our city, that we want to be a fabric of our city, but we want them to do it safely. And again, to Jim Malachis, the chancellor, Javier Rodriguez, the president, and to the governor's office, Governor Cuomo, this is a great partnership. We're going to continue this testing going forward and continue to work with all the great colleges here in Albany County to make sure that the students are doing the right thing, we're protecting them, and continue to educate them. Also available too is all the new appointments at the CVS stores have drive-through testing now. Their locations are at 885 Central Avenue, 3916 Carmen Road, and you can go to the CVS website. And Albany Med urgent care locations are offering the nasal swab and antibiotic testing as always, along with Priority One, who's been a great partner of us and with us in Gilliland. You can call them at 518-867-8040. As new testing is becoming available, you're seeing sites pop up. Price Chopper and other ones are offering them too through different locations, and again, in a partnership. So it's going to be very convenient to get tested. We want to get more people tested, and we want to continue to get all that stuff done. One of the things, just to put the full number out there too, so far in Albany County, we've had 1,583,215 people get tested. Out of that number, 3,343 tested positive, and positive results are 2.11%. So, yeah, again, we can sit there, and I know people point that out through the dashboard. That's why the dashboard's there. So you can go on it, you can read it, and you can check it out. We're not arguing with you. I'm not the scientist. All we're trying to do is continue to tell people to be vigilant. Please be vigilant. Please if you think of anything, protect yourself and protect your family. And again, we can get through this by working together. If you're looking for a rapid anti-testing in Albany County, also you can go to Central Med Urgent Care on Central Avenue, Community Care Physicians in Latham. Both will test children. So just to let the parents out there know. Rite Aid in Colony has a drive-through at riteaid.com. And then again, as Walgreens, go to their website. And I can't thank enough for the business owners stepping up in the different areas and partner with us on this to continue to get the message out there, but to help with all the testing sites that we will be having up and running for your convenience. And again, I will say this, it's up to all of us. We're in this together. If you see someone not wearing their mask or doing the right thing, just walk away. There's no sense of arguing with people. We've got to remember, the only way we're going to get through this is working together in a partnership, and we will get through this because Albany County is strong and we're resilient, and I can't thank the people here enough. Dr. Whalen.
Thanks, County Executive McCoy. Before I talk about anything COVID related, I think my first message is that we have entered flu season, and I would continue to advocate for people to get their flu vaccine. I received mine. It is available at local pharmacies. Many of your providers' offices will have it, and you can call the Albany County Department of Health as well to get a seasonal flu vaccine. What we are concerned about, flu season is upon us every year, and every year we urge people to get the flu shot because we know not only does it protect you against getting the flu, but it also can lessen the effects of flu. So it is a vaccine that is proven to help people. And what we want to avoid this year is to have a lot of people with flu at the same time we may have a lot of people with COVID. As you know, we always are concerned about hospital surge capacity and ensuring that our hospitals have enough room to care for those that develop complications of either COVID or flu. So this year, more than ever, it's important to get a flu shot. I encourage you to do so, and for those of you here from the media to continue to promote that very important message. We are seeing cases of COVID and watching to see, whether this uptick remains consistent. It is something that we were concerned about over the summer and that we've discussed many, many times at this press conference. And we see what's happening in other places of the country where there are larger amounts of cases. The good news on this is that, when we worked together in April, we were able to keep the numbers in Albany County such that we did not see a great deal of hospital surge capacity being tested. I believe that we still have the capability of doing that, but again, want to ensure that everyone knows that they all have an individual responsibility in controlling COVID in their community. And this includes wearing your mask, avoiding large gatherings. And I know Dr. Fauci was talking yesterday about family gatherings in the upcoming holidays. It's important to consider the protection of your family, particularly those that may be older or more vulnerable medically. You want to protect them. Although we all want to get together with our loved ones, although it is something that everyone looks forward to at this time of year, this year has to be different. It has to be different until we get to the point of having a safe, effective, and widely available vaccine, which does not look to be on the table until the new year at the very earliest, and I think it will likely be spring before that's something that we have available to all of us. So as the county executive indicated, as we continue to message daily, it is very important to remain vigilant, to remain concerned, and to act accordingly so that you can protect yourself or your family members. We are continuing to work with our state partners and with our hospital partners and many of the commercial partners on availability of testing. We are working with our school districts to make sure that there's continued safety of the students that are attending in-person classes. And I have a daughter who's attending full-time in-person classes. So as a mom, I know the importance of this and the concerns that a lot of parents have. The partners at the schools have been very proactive, and we want to ensure that kids that are excluded have availability to safe testing and rapid testing, quick testing, so we can get them back to school if they are not infected with COVID. So we continue to work on multiple strategies on testing going forward, and hopefully in the coming weeks we'll have more to share with you on that. We're here. The health department continues to investigate every single case. We continue to promote the public safety messages and work with all our community partners to ensure that we can bend that curve. We're back to that saying again. If there is going to be a second wave, we want to make sure that we have the same armamentarium of approaches we used before, so that we cannot, so that we avoid getting a large number of cases. Thanks.
Thank you, Liza, and thank you to the Department of Health for everything that they do. All you have to do is just go online or look at some of the news stories going around the world, but CNN reported a Dutch woman who contacted it twice, and it was more severe. And then there's a great segment for a 25-year-old man who became the first in the U.S. to contact it twice, second time being worse. So the people that do have it and you think that it's going to go away and you're immune, you're not. You're not immune, and that's the problem with this. It's not like when you get chicken pox and your mother or father used to bring you all into one room and make sure every kid got it so they could get it over with. I've seen families do that, and I'm like, are you kidding me? Because this affects everyone differently. And it is changing and morphing, and that's a thing that I think is probably having the scientists the hardest to control this. But please continue to do the right thing. Wear your mask. Cough in your arm, wash your hands, stay 6 feet apart, and we're going to get through this. We're going to get through this. And I do want to say, I did leave Marsha White out from St. Rose, president there. She does an awesome job, so I want to thank her, too, for her leadership at St. Rose. So I do want to end on one other note. I want to remind everyone that today is a very important day because it's the last day you can be counted. As you know, our census is down, and that means millions of dollars we can lose out in the county of Albany, which goes to so many vital services, and part of my equity agenda, part of Mayor Sheen's equity agenda, and every mayor and supervisor in this county of ours. We need your help. Please take 2 minutes. It takes 2-3 minutes to fill it out so we can get there. You can go to census2020.gov. Also, the mental health is still available 7 days a week from 8 a.m. to 5 p.m. 518-269-6634, and our 24-hour sexual assault hotline number, 518-447-7716, and the United Way partnership. And again, thank Pete Gannon for his leadership and everything he's been doing in the community. 211 in New York State hotline, 188-364-3065.